Welcome to the office.
Hi, Jacqueline.
Hi.
Welcome back.
Thank you.
Happy Tuesday.
Happy Tuesday.
So I saw you before my Dubai trip,
Yes.
and we have some updates.
We do.
Talk to me. What's been going on your journey? I think they want to know.
All right. So our last visit was pivotal because, it was like an emotional session.
Can I clarify? We actually didn't film that visit.
We didn't.
And that's okay. And a lot of stuff came out, right?
A lot of stuff. But what I remember the most is what we ended with, and you said like, today's not your day one, but it's your day one.
Mm-hmm.
And man, did that ring true.
Do you know what I meant by that?
Yeah.
So you've been with me a few months now, okay? Several months.
Yeah.
And it's not that I'm seeing you like 2-3 times a week, or that's not our plan.
Mm-mm.
But when I see you, we're doing well. But the last visit, you had that emotional release.
Mm-hmm. Hard. Yeah.
In a great way.
Yep.
And that was your day one. That's what I meant by that.
Well, for me, it also felt like we unlocked something that we didn't before. And the best way I can describe it is, you know how you have a hose, right?
Mm.
And we had all those kinks, and it wasn't allowing the flow.
Mm-hmm.
Well, that last adjustment that we had, I feel like it cleared the kinks.
Was that the L4?
It was S3. It was S3 and L2, I believe, or L2 or L3, but two major ones. And what I've been experiencing this time is like, I don't feel like that, like I know it's going to be here or something kind of feeling. I've been feeling like we've cleared the kinks, but it's not like the hose is like that.
So it's still twisted a little bit.
It feels that way, but my body...
Unkinked, but still twisted a little.
Yes, now I feel like that result of like the length of my leg and how my foot's been dropping, and then the way my shoulder feels like this, and even when I walk and like I can see my frame, and I just feel it because for the first week after, I felt, it's so weird to say, but like I felt like I hated like walking, standing, or bending down or bending over, because it was just kind of like, I guess like the unevenness or whatever is going on in my pelvis. It would just like bring up these emotions, and it would trip me out because it's like, well, it's just like everyday normal stuff, but I could feel it in my body, and it's so like clear now. Whereas before it felt very chaotic. Now it feels more clear, but I feel centered, but I just feel ready. Like I feel ready for that shift to start happening. Yeah.
You ready to go deeper?
I am.
All right.
I am.
What else?
I think that's the main thing, and we'll see it when I'm walking, is my frame feels like I'm literally like, I'm like hopping over, like I'm walking like this. Although I'm like consciously telling myself like, normal like that, I can feel my frame. And what came up was, I remembered my grandma. My grandma raised me, and I remembered like my most favorite comfortable sleeping position was on the side, like on her arm. But my leg was, I remember, because it's just like my sleeping position. This leg was always extended, and this one was bent, and like she would like rock me or pat me to sleep, and I just feel that in my body, that position, I feel it. And I also remembered...
Is she with us, or is she passed on?
She passed at 99 last year. Yeah.
She passed away last year?
Yeah, last year she was at 99.
And you've let her be free?
Yeah.
You're not holding her back, right?
No, she's with me.
Cool.
Yeah.
What's her name?
Luz Mira.
Luz Mira.
Yeah.
Okay.
Luz. Like Mira.
Yeah, nice. I like
know.
it. Okay.
But another memory that came up too was when I was in elementary. I remember I used to play soccer. I used to love playing soccer, and I remember kind of just feeling like something happened because I stopped playing it, and it makes me think of my ankle. It really does, because I remember you said like this, whatever happened to my ankle was a really long time ago, and just like thinking back on my my past and how I've grown up, it's like, yeah, my body really has taken a beating in some way. Like it really has taken on this trauma, and I can feel it opening. I can feel it coming off. I'm aware of it, and I'm super grateful for it. I could like cry a tear and everything, because I get really emotional just thinking of like my progress and this journey that we've been on.
That's awesome.
I'm ready.
You ready?
Yeah.
Let's do it.
Thank you.
You're welcome. And everyone has different experiences, and some people release right away, some people take a little bit longer, and it's not about forcing it, it's when you're ready. And not everyone gets it, not everyone actually gets it. Let's see what we got, Jacqueline, starting at the base of the neck. Mira, man, don't sleep. I got C1 on the. We've been doing C2 on that left. Mm-hmm. Today C1 is showing up on the right, yo. Unless that 2 is hanging up with it, but let's see. Número 4. Mm-hmm. Su corazón. That's heart for anyone who doesn't understand Spanish. Oh, 3. Oh, God. L3, yo. Clear here. L3, T4, C1 today.
Nice.
Let's take a look and see. We also did pelvis too, though. Head down. We'll check your pelvis has been better?
It has.
But still there.
It's still there.
Back in LA. Back slowly towards me. That's 5. That's 4. That's the one I'm getting.
Oh, yeah, that's up.
5, 4, and 3.
Oh, it even like moves that way.
4, 3. Let's check up top. Center on the chair for me, please. But the good news is you're not sweating.
No.
You're getting better, yo. I like it.
I'm feeling warm though.
Yeah, you're getting there. That's right there.
Ooh.
C1 is a ASRA. It's slightly anterior. We need to bring it back and set it across. Ooh. Okay, you ready?
I'm ready.
So here's the plan for how are the toes?
We got
some movement?
Yeah, we got some movement. I've really been walking a lot. It doesn't feel like heavy. The signal's clear. The numbness has lessened for Good. Sure. It even in this area right here, I've
Are you getting pain sensation. Where it was numb? That's what I want.
Yeah, like right here. It's
so
right
where
here.
It was,
and it feels like it wants to move, but it doesn't, and it throws a hot signal every now and then where it's like, ooh, ah. Yeah.
Okay. We'll take a look at the ankle at the end.
Okay.
One of the things with numbness cases, which is unique in this work, typically they come with pain, pins and needles, things like that. We want that reduced. But in a true numbness case, where the area that is numb, we want there to be pain there, and we know we're on the right track. Yeah. So that's the key we're looking for wherever it's numb.
Okay.
Okay?
All right.
Ready?
Let's do it.
Sit back for me. Showtime. Welcome to the Chiroverse. Mm-hmm. ASR, so we got to turn the head in. That's a baby one. Drop. Nope. You're going to make me do an alternate. Posterior arch on the atlas. Right there.
Ooh.
Gotcha. Walk it off once, please.
Right.
Let's go on the Hylo.
Right.
I actually do want to do your pelvis.
Right.
We'll do the left pelvis.
Okay.
And T4 here.
All right.
Okay? Enjoy.
Well.
1, 2, 3, 4, T4.
Oh.
Clunk. Nice. PIIN, left pelvis. Your inflammation has been coming down, yo. Holding the right ASCX. We're going to push this up and out. Gotcha.
Let's walk.
It
Nice.
Yeah. All right, you know what time it is. Oh, yeah. Let's come on over here. L3 to the knee, the ovary. 5, 4.
Oh.
That's the home run. That was crunchy. Bring your knees back a little bit. Want to get a tiny bit more. There's the rest. Gotcha. Good stuff. That's what we have to get out. Take your time. You ready?
Oh, thank you.
You're welcome.
That's it.
That was it. There's my hand.
Thank you.
Come on up. Wait a second.
Oh my goodness. Yeah, that feeling. It's so crazy, man. Yeah.
I'm gonna move this out of the way for you.
All right.
Oh! All right. Walk it out. I mean, your walk is totally different from day one.
Oh yeah.
It's wild, dude.
Definitely. I was like.
Turn around. Hold on. Let's see. All right, let's have something to compare. Walk. One more time.
I could even feel like the grounding of my feet, just so different.
Your hips are moving better.
Hips are moving. Yeah.
On your back. So we're gonna work on the right ankle. Bend this knee. There you go. You feel that one more when I push?
Yup.
Or that one? That one or that one?
That one.
First metatarsal. Let me get a little leverage. There we go. Superior first metatarsal base.
Ooh.
There. Gotcha.
Nice.
Gotcha.
Yeah.
Now we do the talus.
Nice.
Right leg. It's just process, right?
Yeah.
Tell them it's process.
I had a little give right there. That
Yeah,
nice.
you finally gave. Finally letting it go. But you know, a lot of people think it's a one-time thing, right?
No,
it's a process, and it just depends on the case. It depends on the injury. It depends on the severity. It depends on how long it's been there.
Exactly.
Walk it off.
Hey.
Yeah. Check it out.
Ooh.
Check it out. First metatarsal. Awesome. One more time. I think we're good, girl.
Yeah.
Come on
and
back.
And then I changed my shoes.
Good.
I don't want to wear any other shoe.
Is that right?
Yeah.
Neck is clear. Four is clear. You got a little sweat there picking up. Three is clear. Come back. 5, 4. Mira.
Yeah, big time.
Hielo,
Nice.
hielo, hielo.
Can I pick your brain on one thing?
You can ask me a question.
Yeah. You know when you say like For example, like that video from the in Dubai when you were with the German, you said like first before you do anything in the pelvis, you have to address like the sacrum, what's going on there first, right?
Both ways, yeah,
Both
it depends,
ways.
yeah. The issue is the right hip. Now, if I adjust the pelvis first, I'm going to make that worse. So that's not the answer, but we need to get to that at some point. We need to start on the tailbone.
Okay.
So I need to bring that tailbone up first on that right side, and then I can work on the hip.
What's considered the foundation?
That's a good question. The foundation of the building is the pelvic girdle and the sacrum. It's both.
Mm-hmm.
And then there's clinical judgment. There are rules or parameters that we use to determine which one we're going to adjust.
Mm-hmm.
In your case, adjusting the pelvis will not change the leg length regardless, which is
Right.
good. We're trying to change some of that leg length through the tailbone. However, tailbone is clear now, at least today.
Mm-hmm.
So I'm happy
Mm-hmm.
with that. It's still within limits. And what Gonstead found is as long as that leg length discrepancy is under 7 millimeters, so 6 or less, that's the patient's normal. Don't try to mess with it. Don't mess with nature.
Mm-hmm. Mm-hmm.
Very good question.
Mm-hmm.
Make sense?
Yeah.
Very
Yeah,
good.
it
But
does.
it all goes back to foundation. Now, there was one case I remember one of the docs mentioned at a seminar when I was a student. He was trying to figure out this patient's low back was not holding 2 years. It was a cuboid adjustment in the foot. And what he found in that case was to adjust the cuboid prior to adjusting the low back, and the low back would hold.
Wow.
So everything is different.
Yeah.
It's called bespoke.
Yeah.
It's catered to the individual, right?
Yeah.
And it's going to be interesting. That's the first time we got that metatarsal to move.
That's the first time, yeah.
So
Yeah.
is it because we're getting the pressure off there? Is it because you're more mobile? Is it because you're letting go? It could be all of it.
Yeah.
So we're not going to say it's one thing.
Yeah.
But going back to the foundation, the girdle, pelvic girdle, which is the ilia, the
Mhm.
ilia or the pelvis, the innominate bone, some people call it in the books, and the sacrum.
Is there like a textbook way as to how your pelvis should be moving?
That's a good question too. So the book we learned from back in school, which guess what, is out of print now.
Oh,
And
what?
back in the day, it was an expensive book. It was about $95 when we were in school, and that was a lot for a book. That book's $900 now.
Wow.
White and Punjabi are the authors, Clinical Biomechanics of the Spine. And they are the authorities in spinal biomechanics. So the movement patterns are all there. And you know what I'll do? I will actually do a video, a reel, on explaining individual intersegmental motion, that each vertebrae has already been quantified in the cervical, thoracic, lumbar region, that this is the amount of movement that should be happening in terms of flexion, extension, side bends, and rotation. The
Mhm.
other thing it talks about is nutation and counternutation, which is what? It's the movement of the pelvis and the sacrum. So at the SI joint, when the pelvis moves up, the ilium moves up, there's a nutation, counternutation that goes back and forth like this. So when we have an AS pelvis where it's stuck up, causes a little bit of that opposite nutation going back, so the sacrum goes slightly back, and we have a straightening of the spine. Someone who has a PI ilium, it's gone back, there's a slight forward movement of the sacrum, it stays in that position, and that person has too much curve. Clinical Biomechanics of the Spine.
That's so interesting.
White and Punjabi. They're the authors, but now the textbook's $900.
Wow.
But I will actually make some photocopies and talk about the mechanics and the pelvic girdle mechanics in there as well. And they'll say around 35, 40, we all start to get calcification in there. There's always a little bit of restriction in there. And so we start to get compensation. One more thing I want to mention real quick. This is really important. So runners, athletes, everybody, and we talk about what is the importance of chiropractic in everyone's life. So locomotion in the human body, where does it come from? In a car, we have an engine, right? But where does it come from? Take a guess.
I think of the nervous system.
Part of it, yes, but there's specific motions that happen. I'll explain. I think I talked about it years ago in a video, but I just want to explain this. This is cool. So Locomotion in the human body happens this way. And this is in White and Punjabi. It doesn't come from the hips, the power. It doesn't come from the legs even. Locomotion comes from lateral flexion of the lumbar spine. So this is the way we get locomotion. Starts lateral bend, right? So lateral bend, ipsilateral, same side rotation, lateral bend, ipsilateral. This is where locomotion comes from, okay? So think about one segment is stuck in the lumbar spine and you don't have lateral flexion, so you're not getting locomotion or you're walking off balance. Does that make sense?
Absolutely.
And that is one of the most important keys for everyone's movement, that if there's restriction in the lumbar spine, you're not either getting full power or you're getting uneven power. So you can work it out all day long. You got to get your spine checked.
That was awesome. Thank you.
Thank you for asking the question. I like when they ask questions like that, you know? You're all set.
I appreciate it.
I see you one more time before my next trip out.
Sure.
I'm here till the 19th of February.
Gotcha.
Okay, so why don't we plan around this 18th or somewhere around there?
Yeah, I'm
okay,
down.
couple
yeah,
weeks.
let's do it.
All right?
Okay.
Awesome.
Thanks, Doc.
You got it.